in Ghana, about 68% of pregnant women will test positive for hepatitis B, and it varies across the country, with certain parts having higher burden, up to 10-12% in certain parts of the country. And that's worrying because that means that the babies who are going to be born to these mothers are at risk of getting hepatitis B infection. So really, it's something that we have to try and really tackle from its root causes.
What I found when I moved from the Midwest to the Bay Area, a lot of people who were Asians were dying from a different disease than non-Asians. They were dying mainly from a preventable and treatable disease caused by chronic hepatitis B infection. So I actually started the Asian Liver Center to bring awareness of the importance of hepatitis B vaccination to prevent the next generation of people in the world from getting liver cancer and liver cirrhosis.
I remember seeing a 21-year-old, first in his family to go to university, starting a degree, came with abdominal pain. When we did an ultrasound, we saw a massive liver lesion, and that was the first time that he had been told that he was hepatitis B positive. And for me, that was heartbreaking. And it's not just him. There are several other people in Ghana with similar stories. So really being able to get to the underlying issue, which is hepatitis B infection, its prevention for me is just so important. And that's really what has motivated me to really try and do something about it, because liver cancer in our setting, the main cause is hepatitis B. During this program, I'm going to strengthen interventions to prevent mother-to-child transmission of hepatitis B in my institution, that's the Cape Coast Teaching Hospital. So what I'll be doing is I will create a training module, and whilst I've been here, Dr. So has really been helpful in getting the tools that I will need for this training module. They've done a lot of work in Vietnam and in the Philippines on this already. So I'm really just learning from their experience to use and create tools that are specific for Ghana. And then what I'll also do is I will develop a scorecard to really look at the uptake of these interventions over a period of time.
What Yvonne is doing is very important because Ghana, as a country as a whole, has not introduced free vaccination for newborns within 24 hours of birth, which is crucial to prevent mother-to-child transmission.
The Ministry of Health and the Ghana Health Service have actually been listening and have plans to introduce birth dose. So this project is going to be so timely because healthcare workers are going to strengthen their knowledge about hepatitis B, its transmission, and how important birth dose is to actually prevent liver cancer in the long run.
What we've been doing at Asian Liver Center is, through our research, we take it to the level to change state or national policies to address that. And also we take it to the community, either through going on radio, TV, and talk about the issue, or even offering free testing to the community, because your research is not going to make an impact unless you take it to the last mile and affect behavior change.
For me, I think mentorship has been one major lesson that I've learned. That's something that I will really take away.